I saw your recent LinkedIn post where you argue, I'm quoting, if you are designing for reimbursement, you are not designing for care. And then you extend this to say AI, saying we keep trying to reward digital transformation with analog incentives. Can you explain what you mean by this disconnect?
Absolutely. AI is an interesting one, right? So you were asking me about the difference in virtual care now versus 5 years ago. So in 2025, the way that I see telemedicine is the backbone and the basics of how you're going to be able to have digital medicine part of the healthcare system. It is just the basic. How do you connect with technology, right? And now that we have AI at our fingertips, we are seeing the same cycles that I have seen about discussions about how do you
Hmm.
implement it, how do you pay for it, how are we
Hmm.
going to make quality care, how do we make it safe? The exact questions that I heard over and over and over the last 12 years are happening about AI. And so when
Hmm.
I was thinking about, and this particular blog came out of just seeing that pattern and thinking,
In the US context, correct?
I'm referring to the US context,
Yeah,
yes.
got it.
Saying that other countries have gone about it differently or they're different,
Exactly.
etc. So yeah, I'm talking about the US context. But
Yeah.
when we in general are trying to, in this particular way, like reimbursements
Hmm.
specifically, we're ending up trying to doing the same thing, and I'm worried we're going to have the same problem again. In that reimbursement is going to create products that people can't really use very well because they're actually going to try to build it around what they think reimbursement will happen. And the reason I say that is because, and that's what I mean by the analog incentives, it's like what they think that reimbursement is
Hmm.
happening. Because right now we are still building out those
Hmm.
AI reimbursement codes. There's about two that exist, but again, they're very specific and niche. And so whoever is building is basically thinking, what is going to be the way that we pay for AI? And it's an interesting question too, because at the
Hmm.
moment, the way that we actually pay for clinical care is by how long it takes or the
Hmm.
amount of decision making. And with AI, that might take that away. And so we'll have to rethink how reimbursement happens overall. And so I'm saying that when companies are building just thinking in this manner and trying to solve a problem that they do not know or cannot really predict, it's not going to work. What they actually need to do, and all the telemedicine and RPM platforms that have done this, where they
Hmm.
actually built it for the clinician, for the healthcare system, made it patient friendly and easy. Those are the ones that actually worked. And because theirs worked, they were able to come to the government and say, this is how we built this out. And reimbursement was built around it. And so I'm trying to basically warn everybody you want to actually do it in the reverse way, make the right product. And reimbursement can follow in the way that we do it in the US.